My name is Tracy Balboni. I am a physician who works in radiation oncology. I'm also palliative care trained. I work at the Brigham and Women's Hospital as well as the Dana-Farber Cancer Institute, and there I'm the clinical director of what's called the Supportive and Palliative Radiation Oncology Service, which is a service that's dedicated to caring for patients with advanced cancers using radiation therapy to treat their cancers. I knew fairly early on that I was interested in cancer care, and it was actually some experiences that I had early in my training that kind of really drove home to me that my sense of calling was to be caring for patients with advanced cancers, meaning incurable cancers. And one of those was within my internship when I was only a few months in, so very early in my training, soon after having finished medical school, working very long hours. And I was caring for a young gentleman with metastatic esophageal cancer, and he was just experiencing terrible suffering from his cancer. And at one point, he kind of angrily said to me, if I knew it was going to be like this, I would have shot myself. And he said it was such, he meant it, and with such suffering on every level. He was suffering physically, emotionally, spiritually. And I knew in that moment, it wasn't just that I was, a very inexperienced physician at that point, only a few months into my internship, that was causing his suffering. I knew it was the whole system of care around him that was not able to actually address what was really going on for this man, everything from the physical to the emotional, the spiritual. And so it was experiences like that that drove home to me that there's such a need to care for people well in that setting. And interestingly, so my husband, Michael Balboni, was going through his doctoral training in theology at the same time. And so we would, I'd talk about my experiences in my early medical training. He would talk about his experiences with his theological classes. And we would see how our worlds were talking about much of the same things, and yet there was this incredible gulf chasm between the two, and they never ever met. And that actually prompted me during my internship. Later in my internship, I had a few weeks of elective time, meaning as opposed to the long hours on, on the various clinical floors, I was allowed to kind of pick what I would do. And typically, people choose something as sleep conducive as possible because you're typically so sleep deprived, but in an outpatient setting, like outpatient oncology, outpatient cancer care, where patients are just coming in for appointments, not being seen in the inpatient setting. So I had 2 weeks of this elective time, and I asked the people in my internship, overseeing the internship, if I could shadow chaplains and learn about what they do, shadow them on the floor, see what happens as they visit patients. I hadn't, even though I was now several months into my internship, I actually hadn't been in the same room with a chaplain seeing a patient. And my conversations with Michael had really prompted my questions about, how does spirituality interface with someone's experience with an illness? And so they granted me my request, which was really amazing on their part that they were willing to let me do this. And they asked me to do a project, and the project was to do sort of an overview of the literature regarding spirituality and the experience of illness. So I shadowed the chaplains. It was an amazing experience. It was just such a different lens into the medical setting, into the experience of patients and their families. And then at the end of that couple weeks, I did a presentation to not only the chaplains, but also folks within the internal medicine group on the role of spirituality within illness. And that was my first kind of delving into that literature, and ultimately was my first step towards beginning to do research examining spirituality and the experience of illness. So radiation oncology is a field within oncology that is using radiation as a therapeutic technique to treat cancers locally. So it's used both in the curative setting to treat patients curatively. Pertinent to what I do, I'm typically treating patients with advanced cancers, meaning that their cancers have spread, they have metastatic disease, and radiation therapy is actually a wonderful tool to help patients to live better with their advanced cancer, and radiation is used to control disease where it might spread and otherwise cause problems such as an area of metastasis compressing on the spine, compressing the spinal cord, causing pain, causing loss of neurological function, for example, the person's ability to walk. So radiation is used as a therapeutic technique to treat areas of disease so that patients can live as normally as possible, as well as possible with their cancer, as well as being used curatively. The way to describe how radiation is given is it's most analogous to getting an X-ray. So it's actually, there's a variety of different ways in which radiation therapy is delivered. Most commonly, it's delivered via external beam radiation therapy, which is where the radiation is generated outside of the person and then delivered into the body. And that's the most common form of radiation therapy that I use. And those, what are called linear accelerators, which are the machines that are used to create highly conformal beams of radiation therapy, are on an arm, so the person isn't necessarily inside a tube or inside a donut, which would be typically what a CT scan uses. They're oftentimes just lying on a table with this machine on an arm that's moving around them. That's the most common type. There are certain types of radiation therapy that are delivered with more of like a CT scanner type apparatus, and then there's other types of radiation altogether. So, for example, implantable forms of radiation therapy where radiation is within seeds, typically of some form of metal, and then placed in the body to treat an area of cancer. Prostate brachytherapy is the most common example of that. In other words, it's either generated kind of external to the body and delivered with very sophisticated machines, or in an operating room setting, placed within the body, typically on some form of metal, like prostate brachytherapy seeds, which are these seeds of metal that have radiation therapy within them that are placed within the tumor itself. I'm trying to think of a good analogy. So it is the same. Although it's in many ways, quite different. It's, kind of maybe the best kind of thought of what the difference would be is, Chernobyl would be more like, you get in a bicycle accident and you fall off your bike and you have all kinds of abrasions and broken bones in your body because the injury goes everywhere, as opposed to a highly trained surgeon taking out your appendix. That's the difference. Yes, both involve cutting various soft tissues and all the rest, but one is obviously preferable over the other because one is highly directed in where the tissue injury is happening. And so radiation therapy is using high technologies, particularly given the advances in radiology, the ability to image various parts of the body, and then using the property of radiation therapy, which is that with external beam, it actually doesn't deposit its dose right away. It actually has to travel a distance in body before it deposits its dose. So it's using that property of the radiation therapy, and then using very computer-based technologies to deliver the radiation to create these very conformal areas of radiation dose where it treats the tumor, and then even very highly complex shapes of tumors, and then quickly falls off so that the normal tissues around around the tumor are spared. And of course, radiation interacts with cancer cells by damaging the DNA and ultimately causing cancer cell death. So you're taking advantage of that property of the radiation to bring about cancer cure to the site that you're treating. So anyways, that to me is more of a precision surgeon, removing some part of the body as compared to an injury that sort of inadvertently kills and harms all kinds of tissues, which would be more analogous to what Chernobyl caused in patients. So there's a whole electromagnetic spectrum. So radio waves, very low frequency, they are at one spectrum. Your cell phone is around there, your microwave, and then as you get increasing frequency, you get eventually to ultraviolet light, for example. So from the sun, where the energy of it is sufficient only to penetrate our skin. Hence, that's why you only get a sunburn. It's not like you get a deep burn from radiation from the sun, because it only can penetrate so deep. And then you get to energies that actually can penetrate the body, like what's used for an X-ray. It can interact with the DNA of cells, but typically that's quite minimal. And of course, you still want to reduce X-ray exposure, particularly to young people, because it does have a degree of cancer risk. It's very small, but in large populations, you can see that risk many years down the road. And then ultimately, as the energy increases, you get to megavoltage forms of electromagnetic radiation, which is therapeutic radiation that's used for radiation therapy, where the energy can be delivered to very small structures, like to double-stranded DNA, cause double-stranded DNA breaks, and ultimately that DNA damage results in cell injury and cell death, particularly to cells that are rapidly dividing, which case in point would be your cancer cells, which are rapidly dividing, so they're more vulnerable to that. So it's actually all along the same spectrum, your radio waves all the way up to radio waves, cell phones, microwaves, ultraviolet radiation, visible light, ultraviolet radiation, X-rays, to megavoltage radiation that's used for therapeutic purposes, but all with very different effects on the body. But particularly below ultraviolet light, the things like the radio waves or microwaves, et cetera, are not sufficient to cause DNA damage. So aren't considered harmful. Cell phones, the same. A variety of different research studies have been done to examine the role of spirituality within coping. It's one of the primary ways that individuals cope with a serious illness, and it also is critical to preserving individuals' quality of life in the setting of a serious illness. So, for example, I'm thinking of one study where examining patients with advanced cancers, where patients who were relying upon their spirituality to cope with illness preserved their quality of life better in the setting of high symptom burden. So, those that had lower spirituality, lower measures of religious coping, spiritual coping, when they had high symptom burden, it created greater decrements in the individual's quality of life. So it's really suggesting that coping is really a way by which people are absorbing the stresses of illness, and just translating that research to actual, like, for example, my own experience in caring for patients. It's really one spirituality, which very broadly defined as the ways by which we find transcendent meaning, purpose, and value, typically centered on what is known to be sacred in our lives. And it's if we can experience a stressor in our lives, no matter what it is, but certainly serious illness is a stressor, and integrate it into a sense of who we are in a transcendent way. It allows us to preserve our sense of meaning, value, purpose, identity, despite the fact that you're experiencing something as stressful as a serious illness. Now, that's not to say that some folks have a threat to their spirituality, or they have spiritual struggle as a result of their illness, and that certainly happens as well. You can see individuals really having spiritual suffering because the fact that they are dealing with a serious illness creates spiritual questions, concerns, needs, etc., that aren't resolved, and so certainly can also be a place for spiritual struggle, but it also can be a place for flourishing. I mean, I've seen individuals who, despite the fact that they are experiencing an illness that is, step by step destroying them physically, are actually growing and flourishing spiritually and emotionally despite their illness, in the face of their illness. And oftentimes they'll say it's because of their illness, and they'll actually express a degree of gratitude for what their illness has brought them, even despite that suffering. And in that sense, it's clearly within medicine. We were saying how much it's been neglected in the practice of medicine. Medicine is very focused on the material body, but because individuals, especially a broadly defined sense of spirituality, everyone, especially in the setting of a serious illness, has questions, has ways in which their spirituality is functioning. Whether the atheist or the very devout Catholic, no matter what, there are some ways in which one's sense of central identity come into play. And for medicine to ignore that critical aspect of who someone is clearly missing a whole dimension of what it means to be human. And fortunately, increasingly within medicine, there's a recognition that health isn't just physical, that health is physical, emotional, social, and spiritual. But of all of those, I think the spiritual dimension of illness is the one that medicine has the longest way to go as far as beginning to understand how to integrate and incorporate together with addressing the other aspects of an individual's health. I knew a sense of calling to caring for people with serious illness. I shared the story of the gentleman with esophageal cancer who's suffering terribly from his disease, and it was experiences with patients like that I felt, I think we're all sort of uniquely suited, given gifts, to do certain things in life. And I knew, both because of the sense of burden that I felt for those circumstances, like something needs to be done. And I also knew that I had been, so equipped with the passion that's necessary to delve into this area, and then also equipped with the training, et cetera, to be able to do the research, to care for those patients, et cetera. So, number one, my faith has played a role in simply being that it is my calling. I feel like the Lord has given me that passion, gifted me with the resources that I need to be able to do this work. And certainly my understanding of caring for the sick is that it's a critical part of, as a Christian, of who I am as a Christian, to be embracing and loving those who are vulnerable. And people are, there's many forms of vulnerability in our world, but certainly experiencing a life-threatening illness is an extreme form of vulnerability. And loving people, cherishing them for who they are in the setting of that vulnerability is I know, as a tremendous calling and a gift and a privilege from the Lord. I mean, first and foremost, as my primary training is as a radiation oncologist, a scientist. I think science and the body and is amazing. It's an ordered creation which has ordered ways of bringing about healing, and that is what I'm trained in. I'm trained in those ordered ways of bringing about healing, and I receive medicine as a gift from the Lord. I receive our minds that are able to understand the science of our world and certainly of our bodies and of disease also as a gift. And so I first and foremost view medicine and caring for the sick as an outflow of God's creation and as the primary way of healing people. And it is amazing to see, for example, someone, with just something as simple as a debilitatingly painful area of cancer in a bone, and I treat it, and the person has no pain and is able to go on walks and pick up their grandchildren. And I mean, that to me is a beautiful way of bringing about healing. And there's myriad ways in which we by understanding our world, by understanding the created order, bring about healing to our patients. So I believe that is first and foremost. And I do believe in miraculous healings. I've certainly seen kind of unexplainable by scientific means ways in which people's disease has subsided, allowing for certain things to occur. So, for example, someone's disease trajectory suddenly, you think that they're going to die very quickly, and yet they have this goal to walk their daughter down the aisle. I can think of a patient with this very story, and I think, oh my goodness, they're never going to make it. But this person, their disease just seemingly miraculously just stops, and they're able to actually reach that goal. And I would say that because ultimately, it's so easy to have our minds framed around our material existence, and so we tend to focus on the miracle of bringing about more material existence. But ultimately, I think miraculous healings, they need to have, they should point to our existence beyond this world. And so I don't go about seeking, of course I always want my patients to be miraculously healed, and I hope for that. But my understanding and expectation is that that's only going to be happening in whatever form as it ultimately brings about a healing that's going to be an eternal form of healing, because that's the only, all of us, even if I can prolong, even if someone's cancer that's, advanced cancer, incurable, suddenly all disappears, the person is going to one day die. But there is an eternal existence that will never die. And so where healing happens, whether it's from, biological means, ordered means, or whether via miraculous means, it is to point to the ultimate healer. And I believe that both do. Particularly people that care for cancer patients, I think there is an understanding that people's spirituality in whatever shape is an important part of their experience. And so I think people think it's a little strange that I would do the research work that I do to kind of elucidate the role of spirituality in illness, but at the same time there's an understanding of yes, this is a key aspect of so many patients that we care for. It's hard to ignore. So I think I remember being very afraid of going along this path. In fact, my original plan going into radiation oncology was that I was going to be more of a bench researcher, what's called translational research, which is kind of bringing bench research to the clinical setting, being someone that kind of plays that role. And so I even had a project that I was going to be doing, and ultimately, after this sort of experience over the course of internship, I knew that my calling was to do research work at the intersection of spirituality and serious illness. And I was very afraid to tell my residency program, where I was doing my training in radiation oncology, of my decision to make this change, particularly because it was so odd. So there's a lot of fear, and I think some of that was because I thought that they wouldn't be receptive to the type of work that I was aiming to do. And amazingly, once I finally got up the courage to let them know that I wanted to make this switch away from what would be sort of more conventional for a radiation oncology trainee to something that was fairly unconventional, there was an amazing amount of support and receptivity. I think within medicine, there's many people who understand how our care is so technical that we can miss the bigger picture of what it means to be human. And so for some, even a real encouragement of me to pursue this route. Not that there haven't been naysayers. There definitely have been plenty of naysayers who think that what I'm doing is a waste of time. But I was surprised by the number of people that were very supportive, and I think that comes from kind of a visceral sense that this human aspect of medicine is missing, and it needs work, and it needs to be developed. I do work in spirituality and the experience of serious illness, and yet at the same time, I also do sort of very technical research work on the use of radiation therapy as a very sort of high technology technique in particular to manage disease within the spine, particularly because the spine is such a critical aspect of people's quality of life. Again, pain, their ability to walk, feel, etc. And I think I have found that it's been critical to have both a grounding in more physical, technical aspects of care together with holding and embracing and doing research that examines the other aspects of what it means to experience an illness, and the intersection of spirituality and illness being the primary way that I do that. Some other places of intersection that I think have been important are that although I've done most of my research work on spirituality and serious illness, I work a lot with, for example, Tyler Vanderweel at the Harvard School of Public Health, and his focus is on religion, spirituality, and health. So ways in which one's spirituality, the communal expressions of spirituality in the form of religious communities contribute to health and to flourishing. And I found that there are many ways in which the role of spirituality in serious illness kind of reflects ways in which it interfaces with health. But there's also amazing, I think, new ways of understanding human well-being, human flourishing, by examining its role in healthy populations. And so some work I'm beginning to do is actually expanding beyond the setting of serious illness and thinking about things like, what about the primary care setting and issues like mental health or prevention of substance use disorders or things like that, which I think are other ways in which individual spirituality, but also communal forms of spirituality in the form of religious communities can play very important roles in forming not only the health of individuals, but even the health of larger communities. Yeah, it's amazing to see the human spirit and how, and you also see, one thing I'm constantly reminded of is, as much as we know that we're going to die, it's we forget and we don't see that reality, and I see in my patients who are dealing with the reality through their illness of the fact that they're dying, the ways in which it helps you. Yes, it causes terrible suffering, but it also causes you to keep in mind what really matters. and keeps the questions in the forefront of your mind is, what is the purpose of my life? What is my life about? What is actually meaningful about what we do day to day? And I feel like that I need that daily reminder personally. I feel like many of us do, because we can lose sight of that which is so meaningful, that which is most meaningful so easily, and get caught up in things that aren't meaningful. Anyway, but.
Cool.